Welcome everyone to the Eczema Association of Australasia Inc. and Eczema Association of New Zealand Inc.'s Skin Soldiers live Q&A webinar for Eczema Awareness Day 2021. My name is Michaela Vandenberg and I'm a Corporate Membership Officer for the EAA and the EANZ. Thank you all so much for taking the time today to join us. We hope you learn some great tips, information and resources for how to effectively manage your eczema. To begin, I'd like to introduce you to our panelists for today. We've got the President of the EAA and the EANZ, Cheryl. We've got Specialist Dermatologist at Southeast Dermatology, Stafford, and Queensland Children's Hospital, Dr. Laura Weller. And we have Paediatric Dermatology Nurse Practitioner of the Royal Children's Hospital, Emma King. These fantastic panelists will be providing you with some great insights into teenage eczema and how you can effectively navigate this condition, whether it's for yourself or for your teenager. In today's session, we'll learn more about the EAA and the EANZ, as well as Dr. Weller and Emma's experience before we head into a Q&A session. If you've got any questions while Dr. Weller, Emma or Cheryl are presenting, please be sure to write your answers in the chat on your control panel on the left-hand or the right-hand side. We will then be responding to these questions in our Q&A time at the end. If we run out of time and unable to answer your questions, please send them through to either help@eczema.org.au or give the EAA a call on 1300 300 182. This session will be recorded, so please watch out or keep an eye out for the audio visuals from the webinar on our website and socials. But if you need to refer back to them once this webinar is over, it will be there. Fantastic. We hope you learn a lot from today's session and we welcome any feedback in our post-webinar survey you'll receive once the session is over. I'll now be handing over to Cheryl Tallant, who will provide a little bit of background information on the EAA and the EANZ, as well as the importance of understanding your condition for yourself or your teenager. I'll now be handing over to Cheryl. Thank you so much.
Welcome to our webinar. We know that spring is a key time for many eczema sufferers to have a flare. So we decided this was a great time to bring a webinar to you and address, a specific group that is teenagers who we get calls about, every week from parents who have managed their eczema very well when they were young. And now that they're teenagers, they want to try and manage it themselves. So we want families to be able to work together. At the Eczema Association of Australasia and New Zealand, we provide support and education for all eczema sufferers and their carers. Whether you're a member or you just, know a family member or a friend with eczema, we're always happy to talk to you or answer your emails. We know that, education is the key, and we like to give people the right information, plus send them in the right direction for treatment and help to manage the eczema. The EAA and EANZ are both non-profit organisations, incorporated bodies, registered charities in Australia and New Zealand. We have public benevolent status and medical advisory board. We also have international links, so that keeps us up to date with everything that's going on around the world. Every year we run 2 awareness campaigns for this, for the onset of winter, which is a key time for eczema flares, and the first day of September, because as we all know, eczema and hay fever and asthma, run rife during the spring. We love living in Australia, but we do have a lot of plants and that causes some problems. We are also members of the International Alliance of Dermatology Patient Organisations, well known as Global Skin, and this is an international umbrella group for all skin patient groups around the world, and it's great to get together with some of the other members and discuss things that are happening in their countries and maybe look at how we can improve things in our country to help benefit eczema sufferers. We have wonderful corporate supporters, and we also get some help from Queensland government, and this helps us to provide the most up-to-date educational resources, print our magazine, and run events such as this webinar. So our thanks to all of them. We offer our members many tips on our social media channels to help manage their condition. that can make them feel as though they're not all alone and they're more connected to their community. Sometimes with eczema, it's not a huge big thing you do, lots of little things that make a difference. We also produce and distribute the only dedicated eczema magazine in Australia and New Zealand, our Eczema Quarterly. And, people really love to read it, and we have a lot of doctors and dermatologists that like to put it in their rooms for their patients. And it's another way of making them feel as though they're keeping up to date with new treatments and new products. And also they're not battling on their own. It's a very individual disease, eczema, so we like to help people feel more connected. Also, we produce and distribute our Caring for Your Eczema brochures, posters, patient information sheets, and lots of other literature that people can really read up on it and stay a bit more informed and get some better education. There's a lot of misinformation on good old Google. So luckily, if people find our number and ring us, we're there to help them. So the purpose of our webinar today is to specifically focus on teenagers and puberty and how to navigate their skin condition while battling other teenage concerns. They get acne, they worry about relationships, and they feel different to their friends, so it affects their friendships. It's a really difficult stage of the life when people go through puberty. Throw in a skin condition such as eczema, and learning how to cope with their condition with the extra onslaught of other things they're dealing with. So we're hoping that you get some tips today so you can help your teenager, or if you're a teenager yourself, help yourself manage it better and bring out your inner skin soldier. So give you a bit of a tool, and a bit of armour to work with. So for Eczema Awareness Day today, the 1st of September, we're encouraging people to draw a stick figure on their hand, post it on their social media with their own caption using the hashtag #SkinSoldier, while tagging someone they think is also a skin soldier, or one of their friends, and to encourage them to do the same. So many children and teens with eczema also deal with other chronic conditions because they have allergies such as hay fever and asthma. And we know that the energy required to manage all these problems can be very difficult. Teens would rather focus on outward things like social events, academics, sports, and other activities, despite it being COVID and it's a bit harder at the moment. So that's actually made a lot of teenagers even more introvert. And they really don't want to talk about or bring attention to their skin condition, and if they don't have to. So we find that a lot of teenagers who have been free of eczema since their early childhood, when they had flared skin, find that it tends to come back with a vengeance in adolescence because of going through the changes in their body, their hormones, etc. And we often find too that they do other stuff that's not good for their skin. So it can come back with a vengeance. And we find other teenagers actually develop it for the first time in their teenage years. It's quite a unique condition, eczema. Unfortunately, the effect of eczema on their quality of life, especially when they have to deal with uncontrolled flares, it can affect their concentration, behaviour, definitely their self-esteem and their confidence. I mean, teenagers are really, they have a bit of self-confidence issues as it is, and throw in some eczema and it really affects them a lot. So we think that no teenager should feel anxious, depressed, or have their self-esteem, take a battering through their high school experience because of their eczema. It can be so tricky to manage, not only for teenagers, but their parents too. And it can really have a significant physical and emotional toll on sufferers and their carers. As I said before, we get a lot of mums that ring up that have managed the childhood eczema very well, but the teenager then wants to take over for themselves, and that can cause some problems within the family. So we know that during times of stress or when you go through trauma, our skin, especially if it's sensitive, is prone to flare-ups, and especially when you have an existing skin condition, which can be, acne, super sensitivity, redness or dry, tight, rough skin. And this is all as a result of a compromised skin barrier. Adolescents definitely feel more embarrassed when their skin looks different, especially if it's dry and or inflamed. And it does set them apart from their friends and can lead to social isolation for that teenager. Also, for most teenagers, starting or being in a relationship can be one of the most important things in their life. And of course, having eczema can be really embarrassing. However, we want to try and point out that people are attracted to each other for many reasons, personality and character being probably more important. Skin's just a small part of you, but it is good if they can manage their skin condition well to help with their confidence. So remember, we're here. Let us support you too. Send us an email, visit our website, or give us a call. We're always here to help you. No conditions, no questions asked. Thanks so much for listening. Bye for now.
Thank you so much for that, Cheryl. It was really insightful, and please everyone know that you can reach out to the EAA or the EANZ if you need anything. So I'll now be handing over to our next panelist, Dr. Laura Weller.
Thank you, Michaela, and thank you, Cheryl. That was very interesting. So I'm a dermatologist, and I practice both in private and public practice. Most of my eczema patients are seen at the Queensland Children's Hospital, where I see children of all ages, and a large percentage of those children have eczema, mostly quite severe eczema. So eczema is a fairly common skin condition which can occur in about 20% of children. In general, eczema does get better with time, but we still find a fairly decent percentage of children, 11% by the age of 13, will still have eczema. Those children that continue to have eczema in teenage years do tend to be more severely affected. One way I explain it to parents is that in general, particularly kids with mild eczema, you'll find that it basically just disappears often by the time they're in primary school, and then it's usually by the time they're in high school, they'll have pretty much normal skin. But for some patients, unfortunately, that severe eczema does persist, and for those children, it can obviously be a huge physical strain, but also a mental strain as well. So a question that basically everybody asks, or every parent will ask, is, why does my child have eczema, or why do I have eczema? And often people will come in already having done lots of elimination diets and trying this product and that product. And unfortunately, there's a big genetic basis to why people have eczema, which is frustrating because that's something that you can't control. So we know that when people have eczema, their immune system, in particular the skin immune system, is overactive. We know that the genetic changes that occur specifically affect a protein called filaggrin, which is a skin structural protein which holds the outer layers of the skin very close together. You can see in that little diagram there with the eczema skin on the right that when someone has eczema and their filaggrin's not working, instead of the skin cells being held really tight together, they're instead a little bit loose or further apart, and this means that the environmental allergens and irritants can easily penetrate that skin barrier. We know that people who have eczema have less oil in their skin, so again, you're missing that outer layer of protection on your skin, and that the skin cells themselves, instead of being nice uniform shape, they're often irregularly shaped. These are the corneocytes in the outer layer. So all of those changes basically lead to a defective skin barrier, which lets the immune system also overreact. Once the immune system is triggered, this presents itself how we see eczema, basically with red, dry, and itchy skin. Eczema in adolescence and mental health is a huge topic. But in particular, eczema has been associated with increased rates of ADHD, depression, anxiety, and conduct disorder. We know that when the eczema is more severe, the strength of the association between eczema and these mental health disorders is also increased. And there is also some evidence to show that when you aggressively treat the eczema, so you're hitting it hard with every treatment you've got, at an earlier age, this can modify the risk of mental health disorder in later life for children who are at risk. So that's huge. So what that point is basically saying is that for children who have severe eczema, that it's probably going to affect them mentally. If we can get that eczema under control, overall they'll be less likely to have any sort of mental health problems in the future. So that's huge. So I thought I would just move into some practical tips. So these are just all sort of points that I've thought about that are a bit more specific to teenagers with eczema. So aside from the general sort of measures with treating eczema, it's important that teenagers do keep their rooms tidy. Aside from general cleanliness, this does reduce house dust mites. So another reason for any teenagers listening out there or their parents, just encourage them to clean their room regularly and dust it regularly. They do want to be trying to reduce exposure to allergens and irritants. So this is a big one for teenage girls in particular who get very much into cosmetics and perfumes. Even though that's all very tempting, they do want to try and steer towards products, again, that are going to be less irritating and less allergenic for their skin. And there's definitely lots of great products out there that are suitable to try when you've got eczema. But they've just got to be also careful about choosing toiletries, so that's your shampoos and your conditioners, and laundry products are also really important. So try and steer towards laundry detergents for sensitive skin and avoid any of the extra rinses or sanitizers that can be added to laundry products. Temperature and climate, always really important for eczema, but again, you just want to be making sure that you're not overheating or underheating. And with shaving and hair removal, this becomes more of an issue with teenagers, both male and female. Shaving creams can be really irritating to skin, and they're often just loaded with fragrance. So I usually suggest to parents and patients, try to use your bland emollient or moisturizer instead of shaving cream, and just be really careful with things like waxing, epilation, threading, and laser, because all of those things are going to be more irritating to skin. Usually what I will suggest, if you're really keen on trying any of those hair removal methods, just do a little test patch area first, make sure your skin is going to tolerate it before you proceed to the full face or leg area treatment. Jewelry and piercing becomes a bit important as well. So teenagers will be happy to know they've got a good excuse to go for the more expensive jewelry. We do find cheaper jewelry tends to have a higher nickel content, and a lot of people with eczema will be allergic to nickel. And if you can't go for that more expensive jewelry, and then things with titanium tend to be less irritating to the skin as well. Hair dyes, big thing for females, so definitely you want to do a test patch first if you can, either if you're using a home kit or with a hairdresser. And then just another tip is to use some plain Vaseline to the hairline, so you want to apply it all along there just to try and protect your eczema prone skin if you can, and around the back, around the ears. Obviously you can't protect the scalp skin as much, but you just if you are seeing a hairdresser, just ask them to try and be as careful as they can with application times to the scalp. Tattoos, some teenagers getting tattoos. So unfortunately with eczema, there is a greater risk of skin infection. Not a reason to avoid tattoos, but you just obviously want to be very vigilant if you do get a tattoo in observing the area and treating any infection as soon as you see it. A lot of people do get allergic reactions to dyes, and that does include tattoo dyes. So if you're a teenager or you have a teenager who's very prone to skin allergies, again, it might be worth doing just a little test area first, like a little dot of pigment before doing a full tattoo. The black henna paint tattoos are very popular, but unfortunately that can also be a potent allergen. The pure henna tends not to react so much, but the ones that have additives, definitely I've seen some very severe allergic reactions to them. And again, you want to test patch first. Stress, unfortunately, is a definite flare for eczema, and I often see teenage patients who are flaring around the times of their exams. I think it's good to try and have a bit of a treatment plan in place prior to the exam if you can, so that if you're starting to get stressed, your skin is starting to flare, you've got a treatment plan in place so you can escalate your treatment if needs be. So at least, you know, even if you're worried about the exam, you don't have to worry too much about what your skin is doing. Alcohol, some of our older teenagers out there will be getting into alcohol, and unfortunately this can cause a bit of a physical stress to the body. Also for those teenagers who are on oral medications for the eczema, the alcohol can interfere with that, so in particular methotrexate or azathioprine. So you just have to be really mindful of that. If you know that you're a teenager or you are a teenager drinking alcohol, maybe ask your doctor about what is safe to do in combination with your medication. Acne, very big issue for a lot of teenagers and adults, but basically it's very tricky to treat acne when you've got eczema, because it's almost like these are competing treatments that you need to be using on the skin. For acne, you know, you don't want the skin to be too oily, but then for eczema, you don't want the skin to be too dry. So it actually is really tricky sometimes to treat acne in the context of eczema. So in general, just be really careful with products designed for acne, as these often will contain allergens and irritants. You do want to try and stick to the acne skincares that are not going to be too drying, and a lot of prescription things may be irritating or overly drying to the skin. So you might need to work with your doctor or dermatologist about that. And sometimes I do find for acne, because the skin can be so easily irritated when you've got eczema, sometimes the tablet treatments might be a better option rather than the different topical, either over-the-counter or prescription things for eczema. So again, you've got to see your doctor about that. Bathing, a lot of teenagers do like to have really long showers, long hot showers. I find it's a bit of a trend. Try to keep things to 10 minutes maximum if you can, ideally lukewarm water, not too hot. And again, there's lots of fancy bathing products out there, bath bombs, fancy shower gels, but you do want to try and stick to those soap-free washes or bland emollients when showering. I would encourage teenagers try and use your topical treatment. A lot of teenagers, you know, they don't like going to school with greasy skin, which is completely understandable. So I usually say try and find a lighter moisturizer to put on in the morning, and you might stick to the thicker ointments at night. In general, I do like using prescription ointments at night only, because I think they absorb a little bit better into the skin, and then that way you're not walking around at school with your greasy skin. And you may need to use wet wraps at night just to try and keep your skin under good control. And don't forget that there are lots of other treatments available for eczema. So aside from all the topical things, which people with severe eczema will run through all the options very quickly and then get a little bit disheartened about lack of response, but there are lots of other things available that your GP or your dermatologist will be able to help you with, and these are things like light treatment, in particular narrowband UVB. There are lots of oral treatments available, and we are also very fortunate now to have a biologic medication, dupilumab or Dupixent, available on the PBS, which for a lot of my pediatric patients with severe eczema, this has been life-changing for them. So again, I would just encourage parents or patients, if your eczema is really severe, don't be disheartened. There's lots of things that can be done to try and clear your skin as best as we can. So finally, I do encourage parents and adolescent patients to try and be independent with your treatment. I think it's great if teenagers can do their treatment by themselves, but it's good to have a routine check-in with your parent. So teenagers often get a bit annoyed with their parents if they're, reminding them all the time to put their creams on. So a good way around that is maybe parents just set yourself one day, one time per week where it's a routine check-in, and you leave your teenager to it by themselves the rest of the time, and try and just get into a habit of not the constant reminders, but just that routine check-in. Motivation can be really difficult. So, it's important to try and remind teenagers why they're doing all this why you're putting all this skin treatment on, and try and establish a positive connection between their eczema treatment and their life goals. So for instance, you're doing a treatment today so that you're not feeling itchy. That way you can focus on school, and then that way you can work towards your goal of being whatever it is that they want to do, or if they've got a certain sporting thing that they want to achieve. Try and establish that positive connection between completing their treatment and things that are exciting or important to them. Teenagers have a lot of things going on in their lives, so we're fortunate in the world of technology that we can set phone reminders. So sometimes a phone reminder rather than a parent reminder is good. You can just set that on their phones to remind them to put their creams on at a certain time each night. And then my final point, just to reiterate, please see your GP or your dermatologist if you feel like your treatment's not working or not the right treatment for you. Just remember there are lots of treatment options out there that your skin specialist will be able to help you with. Thank you.
Thank you so much for those wonderful tips and insights, Dr. Weller. It's completely invaluable, and I know everyone here would have learned something special from that. If for everyone watching, please reach out to Dr. Weller at Southeast Dermatology Stafford if you have any further questions or would like to chat to Dr. Weller. I will now be handing over to our last panelist, nurse practitioner Emma King. Thank you so much.
Hello everyone, thanks for having me today, and thanks Dr. Weller for that. So today I'm going to be talking about atopic eczema in children and adolescents, and it's more than skin deep. So I work at the Royal Children's Hospital and also private practice as well at CPMG and Melbourne Neonatal Network. So what is atopic eczema? So normal skin provides a barrier to control temperature, hydration, and protects against harmful substances entering the body. It's the most common skin disease in paediatrics, and it's especially common in early childhood, and there's about 30% incidence in Australia. And I'm from Victoria, and we probably have the worst eczema in Australia due to our climate. Onset is most common in the first year of life. Children who develop eczema after 2 years of age I tend to see they have a poorer prognosis in growing out of it, but it doesn't mean that they can't have a good quality of life. So this skin disease is chronic, itchy, dry, red, and inflamed skin. Staphylococcus aureus colonisation is very common in eczema children, and this can lead to itch, inflammation, and an increase in skin infections if not managed effectively. And these bacterial skin infections can be very common. However, if the eczema is managed properly, they are less common. We've also got to think about the environment that triggers eczema off. So heat, anything hot makes the eczema flare, such as being in a hot car for 10 minutes can really flare the eczema. Going to bed in a hot sleeping bag, as people tend to do, the babies tend to have in Victoria, particularly in winter. Having a hot classroom, dry air can also irritate eczema. So we often say go to Queensland for a holiday when we're not in lockdown, particularly in winter, because in Queensland you have nice humid air. Prickly buff fabrics can also irritate the skin, sandpits, large woolen fibres, and external irritants can also irritate the eczema, particularly around the mouth for babies, but in the older children, perfumes and soaps, deodorants, etc. Eczema does improve with time with a good management plan, and most children go out of it. However, a good plan is really needed to help this happen. As said previously by Cheryl, eczema is linked with asthma and hay fever, and sometimes food allergies, particularly in babies. And it's also can be triggered by external allergens such as house dust mite that Dr. Weller talked about before, or pollens in the air. It can affect any part of the skin. However, it's most common on the face and limb flexures, and particularly in the older child, we tend to see it around the eyes, the mouth, the neck, and the wrists, where they're getting exposure from the environment. Eczema needs multiple treatments and manipulation of the environment to have controlled skin, increased quality of life, and maximal chance to grow out of it. So what does eczema look like? It's very visible, and this is more concerning to the older child when they really worry about how they look, which is very important. So this can impact on confidence, particularly of the older child, and their quality of life. So sometimes they can be very unhappy and don't want to go to school. So one question that we always ask is, are they attending school, and is the eczema leading to absenteeism? So the eczema looks like it's bumpy. Sometimes you can get little vesicles, but often these are scratched and leave excoriated areas. Scratch marks are very common from scratching the itchy skin. Thickened skin, in particular in the older children, is more common. And the thickened skin occurs not from the cortisone, but actually from the rubbing of the skin. So it's a way that the skin protects itself from all the scratching. Skin infections are common if the eczema is not controlled well, and this infected skin looks like weeping skin or crusted, yellow crusted skin. Dry skin, all children with eczema have dry skin because we know that they have a problem with their skin barrier. So applying moisturiser is really important for eczema kiddies and adolescents, because the less dry the skin, the less bacteria, the less inflamed the eczema is, and the more control that they get, the less chance of infection. So it's very important to moisturise from top to toe, at least once to twice a day, even if there's no eczema present. Sometimes children with eczema can have this darker skin or lighter skin. Once the eczema settles down, this does go back to normal skin colour, but you have to have good control again. Itch every child with eczema is itchy, and it can interrupt sleep. So we all know how important sleep is, especially in the adolescent stage, because they need to deal with many things in life through adolescence and cope with things. So it's important that the eczema is controlled again to help with their sleep. In the older child, we tend to find the eczema, as I said before, is around the eyes, around the mouth, neck, wrist, and limb flexures. So what do the older children with eczema face? So often there's some compliance issues because they might be over putting on their treatments. They have other things that may be more important to them. So we need to work with the adolescents and the older child on what creams do they prefer. So as Dr. Waller said before, it's important to get a good cream that works for them, and that's the best cream for them. And creams are good because they're not greasy and they offer a high water content as well, so that does help to moisturise the skin as well. So I will, when patients come and see me, I will get them to try a few creams on, and then they will work out which one's best for them, and I find that helps with compliance. Engage and educate early, so engage with them and talk to them about why we need to do this, and engage them on how to put the creams on. So all the older children will help me put creams on themselves. So if they're more engaged, they're going to be more compliant. We need a good eczema plan that fits into their life. So it's hard to ask an adolescent to put on creams 4 times a day when they've got study and they want to go out with their friends, etc. So work out how often is a minimum time to put moisturiser on and to have their baths, etc. And greasy ointments are not applicable for the older child unless they really like them, of course. So we use creams instead. And particularly for older boys, we don't want to use ointments because it can block their pores, particularly on their legs. Wet dressings may be needed, but we don't do them every night ongoing. We might need to do them, particularly in the child here that's on the slide here, that we might just need to do them for 3 nights. Because if we ask them to do it for a longer time, it's probably not going to get done, but that's all they probably need with it, good creams underneath. So make sure that they're not using products to irritate the skin, trigger it off more, such as strong deodorants with lots of perfumes. Shampoos can aggravate, so using a shampoo that's designed for eczema patients, and perfumes. So I have a patch testing clinic with Dr. Claire Grills at the Children's Hospital, and we find that a lot of the eczema children are triggered off and being sensitised earlier from perfumes. So if they really want to use perfumes, we say put it on your top rather than your skin, but limit this and hopefully don't have any perfumes at all. Makeups can also aggravate eczema. So with school, we encourage the kids to have moisturisers at school. I'll just get you to go back. Thanks, Michaela. And thermal sprays. So the thermal sprays are actually mineral salt water that's come from the mountain in France, and they have an instant cooling effect as well as an anti-inflammatory. So we get them to have them on the desk or in the school bag, wherever they feel comfortable, and next to the bed. So instead of scratching and get out of that habit, we ask them to spray. Educate the other students and teachers to decrease bullying and an increase in understanding of what eczema is there. Ask them if they're missing school, so and check on your, make sure that if your child is not, if they're missing school, that they will need to see your GP, dermatologist or nurse practitioner, and get them engaged back with school again, make sure they've got a good eczema plan. And children with eczema are often tired, particularly the adolescent, even more so just from being an adolescent. So if they're not sleeping well, they're going to be even more tired and less likely to get up to go to school. So once again, a good management plan, but a good environment in the bed. So not overheating with a big thick doona and multiple layers of clothes on and a heater and electric blanket, hot water bottles, they all have to go. Now, what about a shower versus a bath? Well, we actually prefer a nightly bath for eczema. That helps to wash away the staph colonisation of the skin, but also helps with cooling the skin. And if it's a cool bath, not a hot shower, hot bath must be tepid. And also the bath is a treatment, so putting salt and bleach, if instructed, is very important to decrease the staph colonisation. And it's important to be every day. And when they're flaring, we actually ask children to have 2 baths a day. So quality of life can be affected with eczema, particularly if it's more severe. So we engage the peers, school and family is very important. And having the eczema and increasing their confidence will help with this. They may need a referral to a mental health team. And be aware for lower self-esteem and confidence. and once again a referral might need to be needed then as well. So principles of management, we must educate, get rid of all the triggers in the environment, moisturise a lot, get rid of the thick fibres, and consider allergies. In the older child, it's more the environmental ones. So moisturisers should be applied from top to toe, nice and thick, twice a day. But even if you put a cream on thickly, it goes in and you can't see any greasy effects, so that's not going to make them embarrassed when they see their peers or go to school. We must use aggressive use of topical steroids. So on the face, we tend to use hydrocortisone or Alidel, and on the body, a prescription from your doctor, nurse practitioner or dermatologist for Alicon or Advantan are the more common ones that we use. And if it's a discoid eczema, we would use Diprozone. So if your child has an infection, it's really important to wipe away the crusts in the bath. Even if your child goes on antibiotics, removing the crust is more important because the antibiotics can't get through the crust. So we do this by using a chuck cell that you can buy from the supermarket, pop them in the bath, or if they're having a shower, and wipe away the crusts ASAP. Antibiotics might be needed if they've got a moderate skin infection. And we don't use topical antibiotics unless they've got bacteria up the nose that's been shown on a nasal swab. Bath or shower with bleach and salt and bath oil. If you're having a shower QV or a wash, an eczema wash is a good alternative. No soap or no soap-free products that actually are soap. If they're not, responding to these measures, then your child might need a referral to a specialist. Remember to remove products with perfume. Any products with plants in them are terrible as well, or any food ingredients. Steer away from coconut oil and things that have got any food products in them. They can actually lead to problems later on and contact eczema. So eczema treatments fall into two categories. We've got everyday treatments and flaring treatments. So with everyday, remember avoid all the triggers, the environmental triggers. Wear cotton clothing and blankets. You can get cotton thin quilts for winter months. Moisturiser every day from top to toe, twice a day, nice and thick. Daily cool salt and bath or bath. Otherwise, if your child needs bleach and you don't have a bath at home, or your child prefers a shower, then you can actually add bleach and salt to a watering can and pour it over at the end of the shower. Consider vitamin D, particularly for the southern states over winter, because the more severe the eczema, the more lower the vitamin D. That has been proven. Consider a non-soap toothpaste for the for the child that's got eczema around the mouth, such as Pronamel or Jack and Jill, and limit products with perfumes, plants and food again. Now, often flaring treatments are started too late, which is why the eczema gets out of control. So I will teach patients and parents to apply cortisone onto the rough skin, because that actually comes before red skin. So any skin that feels like it's rough, the parents run their hands, or the adolescents rub their hands over their skin, where it's more rough, like sandpaper, then that's when we need to apply the cortisones, then it will never get really red. Wet dressings or wet clothes, wet t-shirt, if it's on the trunk, can be applied for 3 to 5 nights. Some nice cool compressing, all the thermal sprays. Antibiotics are needed if there's infections. And the bleach buds are really important, or the bleach watering can, for children who have moderate to severe eczema, or they're prone to infections often. So the bath or the shower is really important, and a lot of patients come to me and will say, oh, we only have a bath every 2nd to 3rd day. So every day is important for about 10 minutes, and it must be cool, not hot, not warm. No soaps, and the bath or shower helps by removing the bacteria, cooling the skin to reduce inflammation and itch. The salt is less stinging, so if you have a paper cut and you hop in a shower or bath, the skin will sting. But by putting salt in the bath, or the watering can will actually decrease the stinging. Bleach, we use White King, and these are the, this is the formula, so 12 mils for every 10 litres of water. And every day we use the bleach for a month and then reduce over time. And we do have a bath sheet on the Royal Children's Hospital website. We've got also an eczema e-learn on there as well. Wet the face and scalp, because if you don't wet the face and scalp, the eczema and the bacteria will remain here. And just remember that bleach is chlorine and it's actually weaker than a swimming pool. So a lot of parents will think, oh, I can't put bleach in the bath if there's, you know, when it's meant to go in the toilet, for example. But it's a very weak 12 mils for every 10 litres, so it's actually weaker than a swimming pool. So what do we do if there's a lack of good response to the topical treatments I've just talked about? So we look at if they're getting recurrent infections. Do they have a resistant Staph aureus? Or do they have nasal staph, which will not be treated with oral antibiotics? So swab this, ask for your doctor, nurse practitioner to swab the skin and the nose, and then we'll find more information there. If the child's got discoid eczema, so this is eczema that's quite stubborn in these brown patches. We often refer these children for narrowband UVB, or some children might need immunosuppression. For severe eczema, so failure to respond to adequate topical treatments, we will consider immunosuppression or the biologic, which Dr. Weller talked about before. Sometimes we do need to admit children for admission, for respite and to assess compliance, and for creams, wet dressings and baths, but this is very rare. As I said, holiday up to the north of Australia if we can. Assess compliance and mental health, so it's important to, if your child is not coping, it's really important to see your GP or your treating physician, as your child might need a referral for mental health. Assess the topical steroid strength. So often it might not be strong enough, and that's something to talk to your doctor or nurse practitioner about. Consider need for environmental or allergy referral. So particularly if the eczema is around the eyes, around the mouth, and if it flares more in the spring season, that might be something that you might need to get a referral for allergy, an allergist. Patch testing. So as I said before, we have a patch test clinic, and that's something that your child may need if the eczema is not getting better with topical treatments, and your dermatologist should know when this referral is needed. And some support with career choices. So people that have had a history of eczema or still have eczema will often have more sensitive skin, even if they don't have eczema at the time. So we know that concreters or tilers can actually develop contact eczema on the hands due to the products that are within the glues in the concrete, and also like hairdressers that constantly wash people's hair or put dyes, etc., on people's hair. So thank you for listening today. And as I said before, we have luckily through COVID have been able to develop a parent eczema e-learn. This was done before COVID. I don't know how much insight we had, none, but it's been really helpful for parents and it shows parents how to put creams, cortisones on properly, wet dressings, and also there's a mum, one of my patients on there, that talks about eczema to offering a bit of support for parents. And it's an interactive e-learn, so it'd be good for you and your children and adolescents to have a look at, to learn more. We've also got some more information on our website at the Children's Hospital, and Askia also have eczema information.
Wonderful. Thank you so much for that, Emma. Really valuable information. I would just like to thank everyone again so much for those wonderful insights into eczema and tips for teenagers. So thank you so much, Dr. Weller and Emma, for that. We'll now be jumping into our Q&A session. So thank you all for sticking around. We've got some really great questions that's come through already via our panel. So please stick around. I'll be handing over to Cheryl, who will be facilitating the Q&A session. So over to you, Cheryl.
Hi everyone, they were absolutely fantastic presentations that I hope everyone's taken some tips away with them. We have a couple of questions that have come in from people who couldn't attend. I'll start off with. So one of them is, and I'll address this one to Laura actually. My child has really bad acne and is on Oratane for her skin. She also has really bad eczema. What do you recommend that I use for her eczema while she is on this medication? Will anything react badly?
So this is really, really hard because the Oratane is very, very drying. So I usually tell any of my Oratane patients, if they've ever had eczema in their life, you're going to have your eczema flare up when you start Oratane. And it's really, really tricky. So you want to have a very good topical treatment regimen for your eczema in place, ideally before you start the Oratane, because your skin is just going to be so dry. I always say there's no one product that's the best product for everyone, because everyone's skin is really individual. Often what I'll do with my Oratane patients is give them literally an A4 sheet of paper of products that they may find helpful. Basically, you want to get a moisturizer that suits your skin, that you're happy to use. And when you're on Oratane, it's probably going to be the ones that are a little bit more thick and ointment based. And you want to be using them regularly. So like Emma said, you want to be using your moisturizer head to toe all the time, whether the skin is dry or not, because you're really just trying to prevent that dryness. And you want to be using your topical steroid or your topical Elidel or tacrolimus or whatever your nurse practitioner, GP or dermatologist has recommended as soon as you're starting to notice that rough skin, and then definitely if it's red, as Emma said. So it's a bit of a difficult question to answer broadly, because there's going to be lots of different products that are going to suit one person but not the next. Would be my answer for that.
Okay, thank you for that, Laura. Now, Emma, I'll address this next question to you, and this is very common. My teenage daughter is asking about makeup, starting to get into makeup, but she has really bad eczema. Are there any products that you would recommend that she could try?
Thanks, Cheryl. Well, La Roche-Posay have which is a really good moisturiser that we use, and they have good washes and bath oils. They actually have a makeup line that's available at some pharmacies. I won't say names, but so like this is actually, I use one of them myself. So this is Toleraine. The Toleraine brand. So they are actually looking, they're redeveloping also their makeup. So stay tuned for that as well. And you can get it on the web. I've looked it up. And so they've got less bad things in it to cause issues.
Wonderful. Thank you. It is good to have those tips to give to people, because they're often at a bit of a loss. My next question is, and I think we covered this in one of the presentations, but is it possible for someone with eczema to shave their legs? If so, what should they use instead of the standard shaving cream? Well, I think, Laura, you sort of answered that in one of your tips, but maybe just a refresh.
Yes, yeah. So the shaving creams are terrible if you've got eczema. So it's good to try and use, you can just use the plain moisturizer, like what dries the skin with. Sometimes that can clog up your razor though. Alternatively, you can use things like, your Cetaphil wash. You can lather that on your legs and use that, or on the face and use that as your shave cream. But any of those options are fine, and then you just want to be careful with the other hair removal methods, which potentially aren't going to suit people. So those are things like the waxing and the threading, epilation, and laser, which can be quite irritating if you've got eczema.
Yeah, moisturiser is good, but as you say, it can be a bit thick. My next question, which I'll address to Emma, is you know, can you please tell me what the best moisturiser is for my 6-year-old son?
Ah, there you go. So the problem nowadays is, so I have a 20-year-old and an 18-year-old, and there's a lot since when my babies were born to now. I think there might have been a few moisturisers then, and there are so many now. And the problem with the moisturisers that are available, a lot of them have food in them and they have perfumes. And with our patch testing, we're finding nearly every child we patch test is actually allergic to perfume. And these are the older children we're patch testing now. So the moisturiser that is important for 6-year-old is one that doesn't sting, because even some of the good moisturisers can sting. So you don't want them running away and then therefore not getting a moisturiser. But I do have a couple of favourites. We tend to use creams rather than ointments because they are more hydrating. The ointments are good for barriers, but the moisturisers are good for hydration because of the water content. So the ones that we use, the ones that I use myself, they are a little bit more expensive, but in the end they probably turn out to be about the same amount. Atoderm Bioderma cream, or Avene Zerocalm balm or cream. And then for the less expensive are the CeraVe cream, the Cetaphil cream, or even the QV cream. So they're probably my top ones that I would recommend. And once again, not just to the eczema spots, but all over.
Thanks for that, Emma. The next question is, my son's skin sensitivity tests are all negative, but he still has eczema, which worsens midnight at, I think it means at night, between 10 to 2 a.m. and he scratches and bleeds badly. So what can we suggest? Maybe Laura, give us some tips for this poor little kid.
Yeah, so when you say the sensitivity test, do you mean skin prick testing or patch testing? Because they're different things. I'll assume both. We'll assume that both were negative. So often I will find that that is a common thing, that kids wake up in the middle of the night scratching. And I always wonder if they're overheating when I hear that that's happened, because you know, if they're going to bed itchy, that's a bit different to waking up itching. So I'd be a little bit suspicious. Maybe they're getting a bit hot during the night. So it's always good to, you know, check their temperature. I know I've got a 5-year-old with eczema, and she rarely has a blanket on her, mostly her choice. But if you do put a blanket on her, she'll sweat, no matter what time of the year it is, and then her eczema would get worse. So I would be very suspicious that there might be some overheating. You know, try and stick to cotton-based bedclothes if you can, and, you know, lighter sheets and blankets. If you can temperature control the room, great. If not, you know, fans or whatever you need to get a little bit of airflow in there. You know, sometimes there's a role for the sedating antihistamines for children who are just really itchy at night all the time, but those will tend to be the kids who are already itchy from, you know, trying to get to sleep, but they're itchy. They're going to be the ones that benefit more rather than the ones that wake up during the night.
Yeah, I think we all know eczema sufferers that get hot, and I know people that sleep with a fan on even in the winter because they get so hot in bed. And as Emma said earlier in her presentation, no doonas, no heavy blankets. You know, the next question I think Emma would answer for us is, my 10-year-old son is in early stages of puberty, and we need to clean his underarms and use deodorant. Every product I've ever tried irritates his skin. He's only ever had QV bath oil in his bath, but this doesn't seem to clean or help with the body odour. Any advice? Thanks.
So boys can be personality. I've got one of each. So That'll improve just naturally. But something like QV wash, Cetaphil wash, Kenkey wash, they are sufficient, really, and you don't need to use any other stronger perfume things, because once again, we don't want to trigger the eczema off, become allergic to perfumes, dry the skin out. So that should be right. Have a shower every day. Sometimes boys don't like to have a shower every day. And moisturise that area, use a cream. And as far as deodorants go, I find success, I don't know about you, Laura, but I find success with Dove deodorant is better than, but the boys tend to love Lynx, which is very perfumed. So that's probably something to steer them out of. If they really want to have the smell, pop it on their top rather than their skin. So it's something that, yeah, nothing that's really strong in smell. I do also know that QV have a deodorant as well that might help. I'm not sure about crystals with eczema, but also there is some people can use sodium bicarb, a little bit of that in a shaker and pop it under the arms. That might be another option. Not know about you, Laura. Have you got any other tips?
Thanks so much. And I know from reports from members, crystals are usually okay. They don't irritate too much, but they don't really cover the odour very well.
Yeah.
So they're not really, you know, for that for a boy when we want to cover the odour. I think that's sort of all we've got for today. Okay. Do we have some more questions? Sorry. One more question. Do you put salt, bleach and oil in the bath all at once or use separately? So
use a potion.
I'd say for that response, yes, you do. You put them in together. But I'll hand you over to Emma just to go over that again.
So I actually call it a potion. So we pop everything in together and because everything has its job and nothing stops the other from working. And it all works well. And when you start to wean off the bleach, I tend to keep, because I ask the parents to buy a big bag of pool salt from Bunnings or their pool shop. So it's 25 kilos for about $7. That's very cheap. And so I normally say finish the bag. And then with the blend, so that once you finish the bag, you can stop that and see how it goes. But the older kids really like the salt and they have fed back to me that they feel much cooler and less itchy after using the salt. Yeah.
Wonderful, thank you so much. And like Cheryl said, that is unfortunately time on our Eczema Awareness Day Skin Soldiers Q&A webinar. I know many of you have additional questions, so please just send them through to help@eczema.org.au or corporate@eczema.org.au, and we will endeavour to get back to you as soon as possible. Thank you to everyone so much for registering and joining us today, and thank you to those who weren't able to join and still ask questions. I know you're itching to have your questions answered. Thank you also to our amazing panelists, Dr. Laura Weller and Emma King, for donating your time and providing some really great insights into how you can effectively manage your eczema for yourself and your teenager. As mentioned earlier, we have a 5-minute post-webinar survey we would really appreciate if you could please fill out. It will help us understand how you found this session and to help us get an idea of what you would like to learn about in future. If you also complete the survey, you'll be included in a virtual goodie bag that all our wonderful corporate partners have donated to, which is absolutely amazing. They've supplied a range of discounts and goodies to help you manage your eczema over this season. There will also be a random raffle prize draw announced, so thanks again to our corporate partners. So we will be in touch once this webinar is over in about mid-September if you have any ones that you'd like to touch base about. I'd just like to say thank you again for everyone for joining today, and hope you have a wonderful rest of your day and enjoy spring. Thanks again, everyone.